Hello there guys, welcome back or welcome if you're joining for the first time. In today's video, we're looking at the intrinsic activity, talking about agonists and antagonists. Let's start with the agonist first of all. Now, you can have a full agonist, a partial agonist, or an inverse agonist. Hmm. Okay, let's see what an agonist do. For example, now in your blood vessel, you have alpha receptor. An agonist binds to this receptor and causes an effect. Let's say norepinephrine. It binds alpha receptor and causes this blood to vasoconstrict. Now, for a full agonist, like say exogenous norepinephrine or epinephrine, these two we have the maximum effect on the afferent receptor. Same with this drug, phenylephrine. These also have maximal effect. So once they feel 100% of the receptor, 100% of the receptor to have their max effect. So basically, on this graph here, you're seeing them having their max effect, 100% effect. But for a partial agonist, now let's use a mu receptor, which is an opiate receptor that accepts morphine or likes to bind to morphine. And let's say you give this drug, buprenorphine, and it binds to 100% of the receptors. It is going to give you less than maximum effect, despite it binding to all the receptors, because it is a partial agonist. It can't give you 100%, so you're going to have a graph like this for this drug, not getting to 100%. Now, what if you take morphine, which is a full agonist, alongside this partial agonist? Well, you won't be able to get this, no matter how much more morphine you take. You won't be able to, as long as you're taking morphine with this partial agonist, you won't be able to get the full 100% results. So partial agonists, while taken with a full agonist, will act as an antagonist, a competitive antagonist. Now let's look at inverse agonists. To look at inverse agonists, let's go back here again. Now we can see this graph, it started from 12%, 50%, and 100%. The reason for 12% is because the average baseline activity of receptors is around 12%. This is the receptor baseline activity, 12%. Drugs that are agonists usually cause an effect on its baseline activity, mostly by increasing baseline activity. But an inverse agonist, instead of increasing baseline, will reduce baseline activity. It will reduce the baseline activity of the drug. So you give a drug, you have a drug here. You give the inverse agonist to the receptor. The baseline effect of the receptor drops below 12%.